We don't want it to happen. In fact, we do everything in our power to prevent it from happening. And yet, we still hear our patients and caregivers saying things like this.
I've been trying to figure out if I can afford it or not. The specialty pharmacy already got the medication. It's been there for like a month, but they gave me the wrong information about who to talk to about it. But they've had the medication there for a month.
When will I get my refill? This is just like today is unreal. The way I feel right now without my medication, I feel like I've been awake for 3 or 4 days.
I was in the doctor's office on Tuesday, and my doctor said, "Well, how do you like your medicine?" And I said, "I'm not on it yet." He said, "What? It's been 4 months." So he yelled down the hall at someone and told them to get right on it.
We got our free samples 2 weeks ago. Oh, geez. So we won't have the medicine by tomorrow, is what you're saying? Because today was the last day of the samples he has left. Okay, I don't know what to do. It's like an hour and a half drive to the doctor's office to get more samples. So I was praying that things would be resolved and it would be on its way tomorrow. Is there any way you can send me 2 or 3 pills just to make it until we get this settled? No. Okay.
Hey there. Yeah, I was having lunch with a friend, and somebody from quality control called me and said, yeah, you might get it in 2 or 3 days. So I'm just double checking because I've already lost 4 days basically, including tomorrow. Is there any way you can figure that out for me or no? Is there a possibility that maybe I'm just going to get it tomorrow and this lady from quality control was just a little confused?
What we have just heard is the sound of risk. Because despite all of our best efforts to prevent this from happening, we still hear our patients and caregivers describing experiences where they have had a delay in their treatment. These experiences, we know, put us all at risk of losing our patients to other treatments or therapies, at risk of losing our patients to other providers, or at risk of losing our patients to other insurance companies. And worse yet, when we hear this, we know that our patients' health is at risk. At Authenticx, we have a vision to make an impact across healthcare so that we can reduce these kinds of risks. And on occasion, we pause to examine the aggregate of our data, not from the perspective of an individual organization or an individual vertical in healthcare, but to look at all of our data to see what kinds of insights we can gain about the landscape of healthcare as it stands today. On this particular occasion, we studied the aggregate of our data to answer the question, why are patients missing treatment and what can we do about it?